All right, welcome to your EMT Pharmacology exam Cram. We're going to get you test ready, and we're going to do it fast.
So you've got a pharmacology test tomorrow? Feeling that pressure? Yeah, I get it. But you are in exactly the right place. We're going to cut right through the noise and get straight to what you need to know.
Okay, let's get right to it. We're only covering what you absolutely must know to ace this thing. No fluff. We're talking about the stuff that's always on the test, the concepts that trip everyone up, and those sneaky trick questions they love to throw at you. This is all about locking in those points.
All right, first things first, the core lingo. You've got to know these terms. Seriously, they are guaranteed to show up on your exam, and they're designed to be confusing when you're under pressure. Let's make sure you don't fall for it.
Okay, pharmacodynamics versus pharmacokinetics. Here's the easiest way to keep them straight, and trust me, you'll need this. Pharmacodynamics, see the D, is what the drug does to the body. Easy, right? Pharmacokinetics, on the other hand, is what the body does to the drug, how it absorbs it, moves it around, and eventually gets rid of it.
Next up, indications versus contraindications. This one's simple. Think of it like a traffic light for giving meds. An indication is your big green light. It's the reason to give the medication. A contraindication? That's a blaring red light. It's a hard stop, a reason you absolutely positively do not give that drug.
Okay, see how this is all building? Now that we know the lingo, let's get into the how-to. How you actually give a medication and the critical safety check you have to run through every single time.
Pay attention here, because this is a classic exam question. They love to ask about absorption rates. You have to know that IV and IO, that's into the vein or into the bone, are the fastest. They're immediate. On the total opposite end of the spectrum, you've got per os, or PO, which just means by mouth. That's your slowest route. You got to memorize this ranking.
All right, the rights of medication administration. Look, this isn't just something to memorize for the test. This is your non-negotiable safety checklist in the real world. Medication errors happen, and they almost always happen because someone skipped one of these steps. You have to burn these into your brain.
Okay, now for the main event. We're going to do a rapid-fire review of the key EMT meds. These are the ones you are definitely going to be tested on, so listen up.
First up on our list is oral glucose. Pretty straightforward, right? This is what you're going to use for your conscious patients who are hypoglycemic. You know, their blood sugar is dangerously low.
So how does it work? Simple. It's just sugar, and it gets absorbed fast to bring their glucose levels up. But, and this is a big but, look at that contraindication. It all comes down to safety. If they can't swallow or protect their own airway, you just can't give it, period.
And here it is, the classic trick question trap. You have a patient with crazy low blood sugar, but they're confused, maybe they can't follow your commands. Your instinct is to give sugar, right? Nope. If they can't protect their airway, giving them oral glucose is a huge aspiration risk. Airway always wins. Remember that.
Okay, next up, aspirin. You'll see it as ASA on your exam. This is a huge one, a potential lifesaver for anyone you suspect is having a heart attack.
For the test, here's the magic word you need to remember for aspirin: antiplatelet. It makes the platelets in the blood less sticky, so they can't clump together and form a clot. That's why it's so important in a potential heart attack.
All right, let's talk nitroglycerin. Now, this is one you won't be giving on your own, but you'll be assisting a patient with their prescription for chest pain.
So, what's nitro do? It's a vasodilator. Big word, simple concept. It widens blood vessels. And because it does that, it lowers blood pressure. That leads us to the two giant flashing red lights you must check for. First, is there systolic blood pressure below 100? If so, no nitro. Second, have they recently taken any erectile dysfunction drugs? This is a huge one.
Okay, listen up, because this isn't just a test question. This could kill someone in real life. It is guaranteed to be on your exam. If you mix nitroglycerin with a drug like Viagra or Cialis, their blood pressure can bottom out fatally. You have to ask. Every single patient, no exceptions.
All right, next on the list, epinephrine. This is the drug for anaphylaxis, that severe, life-threatening allergic reaction.
Epi is a powerhouse. It does two critical things at the same time. One, it constricts blood vessels to bring their blood pressure back up from a dangerously low level. Two, it dilates the lung passages, the bronchilus, to open up their airway so they can breathe again. It's a total game changer.
And boom, another classic test trap. Your patient gets stung by a bee. They've got some hives.
but they're breathing fine and their blood pressure is stable. Do you give epi? The answer is no. Epinephrine is a serious drug with serious side effects. You save it for true life-threatening anaphylaxis. That means they're either struggling to breathe or showing signs of shock. Hives alone just don't cut it.
All right, we're almost there. Let's wrap this up with the one principle that ties everything we've talked about together: patient safety.
Look, medication errors are way too common, but they are almost always preventable. Your diligence, your attention to detail, that's what protects your patient. So always run through your rights and do that verbal cross-check with your partner before you give anything.
And finally, never forget the #1 rule in EMS. If you didn't write it down, it didn't happen. Your documentation is not just paperwork. It's proof of the care you gave. It's a medical legal document. It is absolutely critical.
And that's it. That's your high-yield pharmacology review. If you can master what we just covered, the lingo, the rights, the drugs, and especially those trick question traps, you're going to be in great shape for your exam. But more importantly, you'll be ready for the street. You've got this. Good luck.